You don't look sick. This is the most common thing I hear when I share my life with chronic illness with someone. I'm going to be 40 this year. That often surprises people. From the outside, looking in, I've lived a privileged life full of opportunity, creativity, and support. I'm educated, self-employed, and I identify with the pronouns she and her. I'm immensely grateful for all of this because my life could have gone a very different way. You see, statistically speaking, when someone experiences early childhood developmental trauma, especially before the age of 6, they're more likely to have a substance abuse or addiction issue, commit suicide, or have a severe mental illness. At the age of 32, I was diagnosed with endometriosis. It's a debilitating and painful condition that affects 1 in 10 women. My health spiraled down into a long decline of various diagnoses. Things such as autoimmune disease, fibromyalgia, chronic fatigue, and prediabetes. On top of that, my list of symptoms continued to grow. The majority of my 30s were spent at doctor's appointments, filling out patient paperwork, navigating portals, and calls to the insurance company. It was exhausting, overwhelming, frustrating, and hopeless amidst the chronic, unrelenting pain. And while I'm not here to talk to you about my experience of living with chronic illness, it is important for me to share that living with declining, ever-present mystery health conditions has been the greatest challenge of my life. In 2016, I found a plant-based lifestyle after trying nearly everything that made a huge positive impact on both my symptoms and my quality of life, especially after being bedridden for several years. I wouldn't be standing here today without this immense gift. And despite feeling better physically and gaining my quality of life, there was something still missing in turning my health around. This was finding nervous system health. What do I mean by this exactly? When I found that there were incidents in my childhood that directly affected how my biology developed, I was able to make a direct correlation to the onset of illness in my adult years. Now, I'm not an expert or a trained professional in this field, so I can only share with you my own experience and what I've been learning. The nervous system is a complex computer full of nerves and sensory organs that connect our brain and spinal cord and control our bodies. The central nervous system controls our thoughts and body movements. The autonomic nervous system controls our body functions like breathing, our heartbeat, and digestion. It's further divided into 2 parts, the parasympathetic nervous system and the sympathetic nervous system. The sympathetic is our emergency response system. This is where fight, flight, and freeze take place. We use this system for recognizing stress and danger and confronting anything that puts our safety at risk. The parasympathetic nervous system is our housekeeping system. This is where, when we feel relaxed or calm, this system is active. Further divided into 2 parts, the lower dorsal is where actions like rest and digest and feed and breathe take place. This system is online when we are born and is mostly automatic. The social engagement area of our nervous system is modeled after our main primary caregiver's own nervous systems. This system is not online when we are born. It helps us learn how to bond with others. It's the site of creativity and where we learn how to cope. Our autonomic nervous system is always working together, looking out for us, asking the question, is this safe? From the outside, looking into my life, you'd see a well-loved firstborn child, the first granddaughter, and a big sister. She is shy and quiet, but she's adored by her family. She loves to play with her dolls and do art, and as she grows up, she likes to climb trees, read books, swim, and play make-believe. She has a couple of school friends, and she enjoys playing with them and spending time with her little brother. She's a good student, and she aims to please her teachers. When she grows up, she wants to be a farmer, a mom, and a doctor. What you don't see, looking at these pictures, is at the age of 4, she is broken inside. She no longer feels safe in the world after a trusted daycare worker and babysitter repeatedly molested her while in his care, threatening to kill her little brother if she ever told anyone. She believed him, so she never told. She locked those memories deep down into the deepest parts of herself, She learned that becoming self-sufficient, independent, and unconsciously made the decision that taking care of her own needs was the only way to survive. At the age of 5, she started to have strange health issues. She was sick all of the time, and she was later diagnosed with asthma and food allergies. 4 years later, she was molested again by another trusted adult. She already knew she couldn't tell. It wasn't safe. So she locked those memories deep inside with the others. In photos, she smiled, but at school, her classmates asked her why she was never happy. She started to have thoughts of not wanting to live, and shortly after her 8th birthday, she acted on that impulse by drinking a Dixie cup full of her own urine and taking a partial bottle of children's Tylenol. And as comical as that failed first attempt was, the intent of it was ever so tragic. This is my trauma. Generally speaking, and across the majority of medical and psychological fields, trauma is referred to as a constant reliving of traumatic experience through memory. Nervous system educator and life coach Emily Beatrix refers to trauma as too much, too soon, too fast, and without your consent. Trauma has historically been thought of as life-threatening experiences resulting in victims and survivors, such as war, combat, murder, school shootings, natural disasters, sexual abuse, domestic violence, and physical abuse. These types of horrific events are often associated with PTSD, post-traumatic stress disorder. They are commonly referred to as big T trauma in the psychological world. Little t traumas are defined as highly distressing events that affect people on a personal level. These are non-life-threatening injuries, emotional abuse, the death of a pet, bullying, harassment, or even can be the loss of a significant relationship or a loved one. These types of events are not typically recognized as trauma in the clinical world. Nervous system health is a fairly new topic of conversation, gaining recognition and awareness in the last few years. But it's an area of study that has been actively researched for the last 4 decades. In further exploring the definition of trauma across modern experts in the field, the perception of trauma and how it affects us on a biological level is starting to shift. Trauma is a fundamental feeling of threat. It's a perceived lack of safety, and it's different for everybody. It's more about the impact than the cause, and it's about how the trauma is remembered in the body. My big aha moment around the impacts of trauma in my life were while listening to a podcast interview with Ayman Gatti. Around the age of 5, she was sleeping in bed one night with her mother, and she witnessed her father brutally murder her mother. Her life abruptly changing as she was separated from her siblings and thrown into, in her experience, an abusive foster care system. What struck me was I could relate to everything she was saying about her childhood experience. How could this be? Her trauma was way worse trauma than my own. I mean, after all, my incidents were contained, and I had done countless hours of therapy around them. But I was continuously amazed that something that happened 30 years ago in my life was still affecting me today. According to neuroscience, 90% of our behavior is based on our history. When this history includes scary or intense situations, or when you aren't allowed to tell or you aren't believed, then that stress response stays lodged in the body. The nervous system doesn't forget, and it doesn't care what the trauma was. All trauma is considered equal in our bodies. So why do people react or respond so differently to trauma? It really comes down to the resilience in your nervous system. What I mean by this is your flexibility, your sense of safety, and your ability to seek comfort and connection with others. When an animal escapes a close encounter with a predator in the wild, they're visibly shaken from the event. They return to their tribe, shake the stress response from their body, and then they seek comfort and connection with their peers. Unlike animals in the wild, we are not taught how to remove the stress response from our bodies. The impacts of trauma don't always manifest in obvious ways. Sure, it can lead to addiction and violence, disassociation, and anxiety. But trauma can also show up as always being prepared. Fear of the dark, rescuer tendencies, being a perfectionist, workaholic, and even being amazing in a crisis. Hypervigilant, self-preserving, survival behaviors. Trauma can also show up as illness. Symptoms without an explanation, such as digestive issues, headaches, rashes, just to name a few. Dr. Vanderkolk, in his book, The Body Keeps the Score, shared of a study that he did working with the memory cells of the immune system. What they found was that on a deep level, the bodies of trauma victims had an immune system that was oversensitive to threat and danger, often resulting in an autoimmune disorder. The inquiry into defining trauma goes even further back to when we were born and first thinking comfort and connection. Attachment theory is a psychological model that describes the bond between an infant and their primary caregivers. This in turn affects our behaviors and our emotional development and how we show up in relationships throughout our lives. You can't talk about trauma and nervous system health without talking about how we attach to each other. Almost every book I've read about trauma talks about our fundamental childhood needs, the things such as the need for safety, the need to be seen, and the need to belong. In exploring if and how these needs were met, it gives us a glimpse into our own nervous system's learned response and resilience. Often, if these needs were not met, we've learned to meet them ourselves. It really comes down to this. We need people. They comfort us. They guide us. They help us heal. They assist us in feeling safe and in being seen. From the outside, looking into my life, you see a loving, two-working parent household with close extended family. All of the basic needs are met: food, shelter, and love. The children are encouraged to follow their dreams, and they're given the access and means to do so. Well-funded public schools, sports, scholarships, high school and college degrees. Successfully adulting in the big world, starting businesses, volunteering in the community. On the inside, from a nervous system perspective, after a forced, unwanted first sexual experience in college, abstract sensory overload came flooding in. Dreams became nightmares. You likely wouldn't know that she jumped or frightened easily. She had to be in absolute control of her environment. She didn't trust people, and she had difficulty making close friends. She felt out of control, but she didn't know why. For a while, exploring adrenaline-fueled activities in her 20s. She became a master of saying, "I'm fine," because it was easier than saying, "I'm not okay." Then she moved, after 20 years away, back to the place of her childhood, the place where the abuse first happened, and the memories continued to flood back. She used exercise, running, art, and time in nature with her dog to manage. Then her health came crashing in, and all of the modes of balancing her stress and overwhelm were torn away. This is where we enter back into my world with chronic illness. When trauma gets stuck in the body, either from a life-threatening situation or from our needs continuously not being met, it creates a disconnect in our nervous system. Basically, all the parts are doing their jobs, but at the wrong time. We'll call this dysregulation. The key to healing trauma is learning how to recognize and track our impulses and our sensations, and then find our way back into a state of regulation, also known as the window of tolerance. Understanding this and using the techniques I'm about to share with you are teaching me how to get back into my window of tolerance and how to build my nervous system resilience. The very first thing that I learned to regulate my nervous system was breathing. It seems simple enough, right? This technique made all the difference. You take a deep breath in to the count of 5, and then you slowly exhale it to a count of 10. I still count on my fingers when I do this. Shall we try it together? Taking the time to do this takes you out of a sympathetic nervous system response, survival, and puts you back into a parasympathetic, calm state, or the window of tolerance. On a biological level, it's telling your body that you are safe. Doing this type of breath when you get anxious or triggered, overwhelmed, or short-tempered is a great first step towards a regulated nervous system. Reparenting is the process of regularly showing up for the younger parts of yourself as the caregivers you always wished that you had. It's creating stability, consistency, and the ability to choose. When done regularly, it can lead to feeling more secure in our adult lives and meeting our own needs. It goes beyond just getting in touch with your inner child. Instead, it can work to create a calm in your nervous system like you've never had before. One question you can ask yourself to bring awareness when you get triggered or upset is, how old am I right now? You might be surprised at the answer. Resourcing are the brilliant ways that we have learned to soothe our nervous systems. Often with dysregulation, we reach for things like substances, activities, or behaviors that are indulgent, dangerous, or possibly out of control, looking for comfort. By gaining awareness, we can remove the unconscious barriers and begin to develop strategies that are healthy and nurturing. Things such as thinking of a person, a place, or an animal that brings a sense of calm or joy. It can be changing your favorite binge-worthy show from something that's dark and suspenseful to something that's funny and uplifting. It can be walking in nature. You can't just take away the bad and replace it with the good. It takes 3 to 4 new types of healthy resources to replace one potentially dangerous or unproductive habit. There are many ways to learn to recognize and address trauma still in the body. These can be accessed through trained professionals like therapists or life coaches, in books, on social media, and through online courses. Access to and learning about them are one thing. Even more important is to start being aware of your patterns, your reactions. Why do you do the things that you do? Then, if and when you're ready, you can begin by just picking one thing, one breathing exercise, one technique, and gently practice it. When you become aware, you can make the choice to break the cycle and create regulation in your nervous system. As you grow in awareness, your resilience to life will follow. Discovering nervous system health saved my life. From the inside, looking out, my life looks pretty darn good now. By listening and being witness to my experience, I am being seen and heard, which assists in the repairing of my nervous system. I am now free of the burden of carrying the secrets of abuse. My hope for you is that I've shared something today that positively impacts your nervous system. If we support each other in healing our own nervous systems, think of the possibilities of healing our communities and even the world.